And welcome back. More than 100,000 seniors across the country rely on a non-invasive treatment for the most common form of cancer in the United States, non-melanoma skin cancer. But a proposed change to Medicare policy is raising concern among health experts and patient advocates who warn it could limit access to this highly effective therapy. Joining me now to discuss this is the former Assistant Secretary for Legislation for the U.S. Department of Health and Human Services, Matthew Bassett. And Matthew, thank you so much for taking the time and joining us today. And talk to us a little bit about this here, because how is this, this change with Medicare coverage, how's it really going to affect those?
Well, Daren, good to be with you, and thank you for having me. Well, the good news is today, all seniors on traditional Medicare have access to IGSRT. It is image-guided superficial radiation therapy, and it is a breakthrough technology in its third generation. And to your point, it treats non-melanoma skin cancer. This is done in dermatologist offices all across the country, including in New York. And it is where you go for a course of treatment over the series of several weeks. It is painless, it is non-invasive, and it has a 99.3% cure rate. So it's very popular among seniors. The problem is that there are efforts in Washington where large insurers and even some of the bureaucrats at CMS are proposing to eliminate coverage for a huge swath of seniors in the country. And this is what we're calling folks' attention to.
Yeah. So if this change does happen, how does this affect seniors and what potentially happens from here?
Well, the concern is that they would be removing one of the most effective treatments for non-melanoma skin cancer at a time when the cancer is growing faster than any other form of cancer combined. 1 in 5 Americans will be diagnosed with this. And what's so surprising about this policy, Daren, is that it makes no sense. Again, clinically, it has a 99.3% cure rate. It is widely available. It's great for individuals that are in rural areas that don't have access to large cancer centers. And it is something that is mind-boggling that they would put forward a proposal to limit coverage during Cancer Awareness Month last month. And so what we're trying to do is to drive awareness, because I've been in and around the HHS building for over 20 years. And I've never seen one of the most curative forms for non-melanoma skin cancer for a treatment to be eliminated after it's cured over 120,000 seniors. This should be expanded so that you and I would have insurance coverage to this. To those of us who sometimes spend too much time outside chasing a little white ball, 1 in 5 of us is going to be diagnosed with non-melanoma skin cancer. And so these treatments should be increasing. This is policy that was left over from the prior administration, and I am very, very surprised that anyone would move to limit seniors' options in how to treat non-melanoma skin cancer.
So let's talk about IGSRT for a minute and how this, when this all plays out here, how does this work particularly against the president right now? He had a pledge that he was going to protect Medicare, and now we see this as a potential. How do you make sense of this?
Yeah, for the 10 years that I have known the president and for the years that I served for him, he has always been staunchly against Medicare cuts. I want to be very clear. This is not his policy. This is not part of Secretary Kennedy's policy and the Make America Healthy Again. It is completely inconsistent with that. And Dr. Oz is not someone who is moving forward this policy. This is kind of career bureaucrats who are down in the bowels of CMS, who are, it seems to be that there's a direct correlation, Daren, with as this procedure has become more and more successful and more seniors are asking for it, there are folks in organized medicine who don't like the competition. They don't like this to be treated conveniently in dermatologist offices all across the country, but it is CMS's job to stand up for patients. They're not supposed to pick winners and losers in technology. They're supposed to look at the clinical data and do what is best for patients. And options for patients are what are needed here.
Yeah. Matthew, when you talk about options, one of the options that potentially could fall out from this is higher costs when it comes to Medicare. Have you heard from people, and what's the pushback that you're hearing from people as this is a potential concern?
Well, you raise a great point, Daren, because when people can't get non-invasive treatment, they are forced into a higher cost setting and typically a surgical process. And so a study that came out yesterday showed that this will cost the Medicare program between $1 billion and $2.5 billion over a 10-year period, because patients will either A, delay getting treatment, or have to get surgery whether they are a good surgical candidate or not. And surgery definitely has a place in treating especially melanoma skin cancer. But if you have it on your face or your neck or your ears, and you don't want to have that be something that is surgically removed, you may not even be a good candidate for surgery. So the idea that you could have a non-invasive, non-surgical, painless procedure that has a cure rate that's 99.3% is very attractive to a lot of America's seniors, and we want to make sure they continue to have that option.
Yeah, I mean, you kind of stole my thunder there on that one, Matthew, because I was going to say, when you talk about seniors in particular and surgery at all, most will opt for a non-invasive procedure because we understand the recovery time that's associated with seniors and the things that, the medicine and the whole 9 yards that comes along with any type of surgery that's non-invasive. So for losing a non-invasive procedure, not having that as an option on the table, what do you find to be the biggest risks when it comes to this?
I think the biggest risk, you hit the nail on the head, why would we limit treatment options for the fastest growing cancer in the country? Why would we get rid of one of the most effective procedures? 120,000 seniors have already been cured using this technology. This has been available in New York since 2022, and over 800 seniors in New York have been cured in this technology. So it just doesn't make any sense to limit the options that patients have. And the big problem, Daren, is if a couple insurers get away with not paying for this procedure and limiting options, then the concern is other Medicare insurers will follow. And that's why we have started and launched patientsact.org. And we would encourage everyone who's concerned about this, who's had a family member who's had non-melanoma skin cancer or may have been diagnosed themselves, to come to patientsact.org. It's very easy for you to email the insurers that are considering these changes to encourage them not to go in that direction. That's why they have these open comment periods. And it also allows you to email your congressman, HHS, CMS, and the White House to ask the president to please intervene on this. He has never cut Medicare benefits, and I trust at the end of the day, it will probably take him picking up the phone to make this decision, and I believe that he will.
Yeah. Is this the best way to go about protecting and having access to this?
Absolutely, because even if it's not an insurer that affects you and your coverage plan, if one or more of these get away with doing this, and I've never seen something this successful be removed from the market. And I think shedding light on this and making people aware of it and bringing it to their attention that they have a benefit today that they might not have at the end of the summer. And imagine patients who are in treatment right now, Daren, who are wondering, if this goes through, will I be able to continue my treatments? It is a disaster for no reason, and this is totally preventable. And if people will raise their voices and get involved, hopefully we can stop this and make it so that all Americans have access to IGSRT, not just seniors.
When I think about the numbers of 5 million plus people have non-melanoma skin cancer, 9,500 diagnosed every day. That's an alarming number.
It is. I mean, it's the fastest growing. We all tend to spend a little too much time out in the sun, and most of the damage that we do before we're 15 years old. So it's unfortunately a ticking time bomb for a lot of us. And we have the technology. IGSRT is in its third iteration. It is wildly effective, and it's something that we feel that every American should have covered in their health plan. And we're not going to stop until everybody has access to this life-sustaining and life-enhancing procedure.
Yeah. I know you were nominated by the president in 2017. As we look now and we see what's potentially on the horizon when it comes to this right here, it brings you to great concern. So I would ask you, as a person who's nominated by the president, what changed?
Yeah, I think what changed was this is something that carried over from the prior administration. And unless I've missed a memo, there's not a lot that this president is continuing that the former president was into. So the idea that they would take the worst piece of policy and allow it to move forward is pretty surprising to me. And I think it's more of there's so much going on in the world right now that the key is in a very, very busy news cycle to make people aware of this. And I can't thank you enough, Daren, for having me on to allow me to do just that.
No, it's a conversation that needs to be had. I think sometimes when we look at these numbers, as I said just a few seconds ago, the numbers are startling, to know that this many people are being affected. But as we move throughout the course of every day, we've got 10,000 other things that we're looking at. Many people don't even know when it comes to non-melanoma skin cancer, the rates and the amount of seniors that are actually, affected. I know you're continuing to fight the good fight of faith, but for yourself, as you have these conversations with seniors, what are you hearing from them?
Please don't remove my options. Mm-hmm. That's, let me decide the best procedure for me and based on my clinical need. A lot of people, for various reasons, whether they're hypertensive or whether they're diabetic or whether they have problems recovering from wounds, just don't make good surgical candidates. And so we're saying all options should be on the table in the war on cancer, and we shouldn't be removing any options that would have benefit to patients, especially one that has a 99.3% cure rate. That just makes no clinical sense whatsoever and is more of a turf battle between the different medical societies that feel they're best to treat this. But I think patients are in the best position when they have every clinical option available to them.
Yeah. Matt, before we go, you optimistic things will swing in your direction?
I absolutely am. I am. And it's not my direction, but I think it's in patients' direction. And that's good policy is supposed to benefit the patient. And that's where we want to keep the focus.
Yeah. Matt Bassett, thank you so much for joining us. And we appreciate you taking the time and sharing, bringing to light some very, serious information. As we know, these numbers are very startling, as we said, but numbers that need to get out to the public. Thanks a lot for taking the time with us, and best wishes as we go forward.
Appreciate you having me. Thank you. Have a great day.
All righty. Matt Bassett here with us as well. And want to let you know if you want more information, visit the website at patientsact.org.